I was on my way to work last December on my bicycle and I had a heart attack. Eventually I spent 5 times in hospital, 5 days in hospital between the January and the July. And each time seeing different doctors, each time being told, oh, this will be okay now. And none of them seem to really find the answer.
Most of the cost of the NHS is spent on chronic disease. But if time is taken to find out what the patient really wants and what the patient thinks the operation's for, it was common in my own practice to find that patients had fundamental misunderstandings. And once they were clarified, the patient said, well, why do I want the operation then? And to which I would answer, I don't know. Should we not do it then? In the long run, patients make far fewer demands on the service. They don't need to visit their GPs as often as they did. They require far fewer hospitalisations. And the total savings on those otherwise wasteful interventions considerably exceeds the cost of delivering this high-quality service in the first place. So not only are patients delighted with it, but then so too should be the commissioners.
I mean, how can you not be impressed, like, you know?
Yeah, and it's cheap, because all the times you wouldn't have gone to your GP and all the times you wouldn't have gone into hospital is money that's been saved. I mean, and I think that's something that I think you recognise from the other patients. I mean, all of the patients in the block clinic are always telling each other how they haven't been into hospital for months at a time. The thing that comes out of this is that normal, rational human beings nearly always opt for low-risk, reversible treatments before high-risk treatments with irreversible side effects. And in the NHS, the more risky and the more dangerous the operation, the more costly it is. So if you leave it to patients to ration themselves, they will always go for the low-risk, low-cost option first.